If your first step out of bed leaves you gasping or limping, do not ignore it. Morning foot pain is not just a passing inconvenience. It is a flashing warning sign from your body that damage may be occurring right now. Every painful morning you endure without taking action could lead to worse problems: chronic plantar fasciitis, severe heel spurs, nerve compression, or irreversible joint damage. Early warning signs are a gift because they give you a chance to act before small issues become life-altering conditions. Stretching, supportive footwear, and proper diagnosis are not optional. They are critical if you want to protect your mobility and quality of life. Time is of the essence. Every day you delay, inflammation, stiffness, and structural foot problems grow stronger. But the good news is that early intervention works. You can reverse much of the damage with simple but consistent efforts. Your future self will thank you for acting today, not tomorrow. Do not let morning foot pain steal another day from you. The time to take control is now. Here is the causes and remedies for morning foot pain. 1. Plantar fasciitis. Plantar fasciitis is one of the most common causes of morning foot pain. It happens when the thick band of tissue called the plantar fascia becomes inflamed. This tissue connects the heel bone to the toes and supports the arch of the foot. During sleep, the fascia tightens slightly, and when you step out of bed, it stretches suddenly, causing sharp pain. The pain is usually strongest in the heel or arch. Risk factors include standing for long periods, wearing unsupportive shoes, or having flat feet. Athletes and people who are overweight are also at higher risk. Stretching exercises, proper footwear, and rest can help reduce symptoms over time. 2. Achilles tendonitis. Achilles tendonitis occurs when the Achilles tendon becomes irritated and inflamed. This tendon connects the calf muscles to the heel bone and is used every time you walk or run. Overnight, the tendon can stiffen, and when you get up in the morning, sudden movement causes pain and tightness. The discomfort usually starts at the back of the heel and can worsen with activity. Tight calf muscles, overuse, and improper footwear often contribute to this condition. Gentle stretching, strengthening exercises, and supportive shoes can help manage the pain and prevent worsening. 3. Arthritis. Arthritis is a condition where joints become inflamed, stiff, and painful. In the feet, arthritis can affect the toes, the middle of the foot, or the ankle. Rheumatoid arthritis and osteoarthritis are two common types that cause morning foot pain. During sleep, joints are not used, which leads to more stiffness and pain when movement resumes. Inflammation can cause swelling, warmth, and reduced flexibility. Risk factors include aging, genetics, previous injuries, and autoimmune diseases. Managing arthritis involves medication, physical therapy, and sometimes using special shoes or braces to support the joints. 4. Heel spurs. Heel spurs are small bony growths that develop on the underside of the heel bone. They often form in response to long-term strain on the muscles, ligaments, and plantar fascia. While heel spurs themselves are not always painful, they are frequently associated with plantar fasciitis. In the morning, after hours of immobility, the tissues around the spur can tighten, causing a sharp, stabbing sensation when you stand. Risk factors include running or jogging on hard surfaces, wearing worn-out shoes, and having flat feet or high arches. Over time, repetitive stress can lead to the formation of these calcium deposits. Treatment includes rest, ice application, proper footwear, stretching exercises, and in some cases, physical therapy. Surgery is rarely needed but may be considered for severe cases. 5. Flat feet or fallen arches. Flat feet, also known as fallen arches, occur when the arch of the foot collapses completely or partially. This causes the entire sole of the foot to touch the ground when standing. Flat feet alter the way weight is distributed across the foot, leading to strain on muscles and ligaments. In the morning, after hours of inactivity, the stressed tissues can feel tight, sore, and achy. Flat feet may be inherited or can develop due to injury, aging, or health conditions like diabetes. People with flat feet often experience pain not only in the feet but also in the ankles, knees, and lower back. Supportive footwear, orthotic inserts, and strengthening exercises can greatly improve comfort and foot function over time. 6. Tight calf muscles. Tight calf muscles limit the range of motion in the ankle and place extra stress on the foot. During sleep, muscles naturally shorten and stiffen, and when you first move in the morning, this tightness can cause pain in the heel, arch, or Achilles tendon. Tight calves are common in people who sit for long periods, wear high heels, or do not stretch after exercise. They can also contribute to conditions like plantar fasciitis and Achilles tendonitis. Regular stretching, foam rolling, proper hydration, and warm-up routines can help loosen the muscles, reducing morning pain significantly. 7. Nerve compression. Nerve compression in the foot, such as in tarsal tunnel syndrome, can cause sharp, burning, or tingling pain in the morning. The tarsal tunnel is a narrow space on the inside of the ankle, through which nerves, tendons, and blood vessels pass. When the tibial nerve becomes compressed or squeezed within this tunnel, it leads to inflammation and nerve pain. During sleep, reduced movement can cause swelling or pressure to build, making morning pain worse. Risk factors include flat feet, injuries, arthritis, and diabetes. Symptoms may include numbness, shooting pain, or a feeling of pins and needles. Treatment involves reducing inflammation, using supportive footwear, avoiding activities that worsen the compression, and sometimes receiving corticosteroid injections. In severe cases, surgery may be necessary to relieve the pressure on the nerve. 8. Gout. Gout is a form of inflammatory arthritis caused by high levels of uric acid in the blood. This excess uric acid forms sharp crystals that deposit in the joints, most commonly affecting the big toe. A gout flare often occurs suddenly, causing intense pain, redness, warmth, and swelling. In the morning, after hours of immobility, the pain can feel especially severe as joints stiffen and inflammation increases. Risk factors for gout include consuming high amounts of red meat, seafood, sugary drinks, and alcohol, as well as obesity, high blood pressure, and certain medications. Managing gout involves dietary changes, drinking plenty of water, taking prescribed medications to lower uric acid levels, and using anti-inflammatory drugs during a flare. Early management helps prevent future attacks and joint damage. 9. Overuse or high-impact exercise. Overuse injuries are common causes of morning foot pain, especially in people who engage in high-impact activities like running, jumping, or dancing. Repeated stress on the feet can cause micro tears in muscles, ligaments, and tendons. Overnight, as the body rests, these injured tissues tighten and become stiff. When you wake and start moving, the tissues stretch quickly, causing pain and discomfort. Without adequate rest, stretching, and proper footwear, overuse injuries can lead to chronic problems such as stress fractures, plantar fasciitis, or Achilles tendonitis. Prevention involves balancing exercise with rest days, cross-training, using cushioned footwear, and maintaining proper technique during physical activities. 10. Poor footwear support. Wearing shoes that lack proper support is a major cause of morning foot pain. Shoes that are too flat, too tight, or too worn out can fail to support the arches and heels properly. Over time, this lack of support strains the muscles, ligaments, and joints in the feet. During sleep, the feet are inactive, allowing the tissues to tighten and swell. When you stand in the morning, the stressed tissues suddenly stretch, causing sharp or aching pain. High heels, flip-flops, and unsupportive slippers are common culprits. Even walking barefoot on hard floors can contribute to foot problems over time. Good footwear should offer arch support, cushioning, and a firm but flexible sole. Orthotic inserts can help by correcting foot posture and distributing pressure evenly. Choosing proper shoes, rotating footwear, and replacing old shoes regularly are important steps in preventing and relieving morning foot pain caused by poor support. 11. Sleep posture putting pressure on feet. The way you position your body during sleep can also cause morning foot pain. Certain sleeping positions place unwanted pressure on the feet, ankles, and tendons. For example, lying with the toes pointed downward can shorten the Achilles tendon and tighten the plantar fascia. This leads to stiffness and pain when you stretch the foot upon waking. Sleeping with heavy blankets pressing down on your feet can have a similar effect. People who sleep on their stomachs often experience this more than those who sleep on their sides or backs. Over time, poor sleep posture can contribute to conditions like plantar fasciitis, Achilles tendonitis, and nerve compression. Using a lightweight blanket, elevating the feet slightly, or using a splint that keeps the foot in a neutral position can help. Paying attention to sleep posture is a simple yet powerful way to reduce morning foot pain and protect long-term foot health. Now let us see the remedies for this pain. 1. Stretch your feet and calves before getting out of bed. Stretching the feet and calves before standing up can significantly reduce morning foot pain. During sleep, muscles and tendons tighten, especially the plantar fascia and Achilles tendon. Gentle stretching helps loosen these tissues, improves flexibility, and reduces the sudden shock they experience when bearing weight. A simple stretch involves sitting on the edge of the bed, extending one leg, and pulling the toes gently toward you with your hand or using a towel. Holding the stretch for about 30 seconds on each foot helps warm up the tissues. Calf stretches, such as standing against a wall and leaning forward with one foot back, can also relieve tightness. Stretching boosts circulation, increases range of motion, and prepares the feet for movement. Consistency is key, and incorporating these stretches into your daily routine will reduce stiffness, prevent injury, and ease morning pain over time. 2. Wear shoes with good arch support and cushioning. Wearing shoes that provide proper arch support and cushioning is essential for managing morning foot pain. Good shoes distribute body weight evenly, reducing stress on the plantar fascia, heel, and forefoot. Lack of support can worsen inflammation, strain muscles, and aggravate conditions like plantar fasciitis and Achilles tendonitis. Supportive shoes typically have firm midsoles, cushioned heels, and a contoured arch design. Shoes with poor support, such as flip-flops or worn-out sneakers, fail to protect the feet from pressure and shock. Choosing footwear with a deep heel cup and a wide toe box also helps maintain natural foot alignment. Replacing shoes every 300 to 500 miles of use is important, as worn shoes lose their supportive properties. Investing in quality footwear is one of the most effective ways to reduce morning pain, improve comfort, and protect foot health in the long term. 3. Use orthotic inserts for better foot alignment. Orthotic inserts are specially designed supports placed inside shoes to improve foot alignment and relieve pressure on key areas. Poor foot mechanics, such as flat feet or high arches, can strain muscles, ligaments, and joints, leading to morning foot pain. Orthotics help by cushioning the heel, supporting the arch, and correcting imbalances that cause stress during walking or standing. They are available over the counter or can be custom made by a podiatrist for specific needs. Custom orthotics are molded to the unique shape of the foot, offering maximum support and comfort. Wearing orthotics regularly helps distribute weight more evenly across the foot, reducing inflammation and minimizing the risk of conditions like plantar fasciitis and Achilles tendonitis. Over time, they can improve posture, reduce joint strain, and enhance overall movement efficiency. Cleaning and replacing orthotics as recommended ensures they remain effective. Using proper inserts, especially when combined with supportive footwear, is a simple yet powerful step toward eliminating morning foot pain. 4. Apply ice packs to reduce inflammation. Applying ice packs to the feet helps control inflammation and ease pain. In conditions like plantar fasciitis, Achilles tendonitis, or overuse injuries, inflammation builds up overnight, causing morning stiffness and discomfort. Ice therapy constricts blood vessels, reduces swelling, and numbs sore tissues, providing immediate relief. To use ice safely, wrap an ice pack or frozen water bottle in a cloth and apply it to the painful area for 15 to 20 minutes. Avoid placing ice directly on the skin to prevent frostbite. Icing is most effective after stretching exercises or physical activity, as it helps calm irritated tissues. Using ice therapy consistently, 2 or 3 times a day, speeds up recovery, reduces reliance on pain medications, and supports healing. Combining icing with rest and proper footwear creates a strong defense against recurring morning foot pain. 5. Take anti-inflammatory medications if needed. Anti-inflammatory medications can provide quick relief from morning foot pain by reducing swelling and easing discomfort. Nonsteroidal anti-inflammatory drugs, known as NSAIDs, such as ibuprofen or naproxen, work by blocking the chemicals in the body that cause inflammation. These medications help calm irritated tissues in conditions like plantar fasciitis, Achilles tendonitis, arthritis, and gout. Taking them as directed can decrease pain levels, allowing better movement and faster healing. It is important to use the lowest effective dose for the shortest time needed to minimize side effects. Long-term or excessive use of NSAIDs can lead to stomach problems, kidney issues, or increased risk of heart disease. Always consult a healthcare provider if you plan to use these medications regularly. In some cases, doctors may prescribe stronger anti-inflammatory treatments or suggest alternative therapies like corticosteroid injections. When combined with rest, stretching, and proper footwear, anti-inflammatory medications can be a valuable part of a complete pain management plan. 6. Massage your feet regularly to improve blood flow. Massaging the feet helps increase circulation, relax tight muscles, and break up tension in inflamed tissues. Regular massage stimulates blood flow to the affected areas, bringing oxygen and nutrients that speed up healing and reduce stiffness. Simple techniques like kneading the arch with the thumbs, rolling the foot over a tennis ball, or gently pressing along the heel can provide immediate relief. Massaging before getting out of bed can prepare the feet for movement, making that first step less painful. Using essential oils, warm lotions, or massage tools can enhance the experience and improve results. Consistency is important, and even 5 to 10 minutes a day can make a noticeable difference. Foot massage also helps lower stress, reduce muscle fatigue, and improve overall foot flexibility. It is a simple, natural remedy that supports healthy, pain-free mornings. 7. Use night splints to keep the foot stretched overnight. Night splints are devices worn while sleeping to hold the foot in a slightly flexed position. They keep the plantar fascia, Achilles tendon, and calf muscles gently stretched throughout the night. Without a splint, these tissues naturally tighten during sleep, leading to sharp pain when you first step out of bed. By maintaining a stretch, night splints prevent the tissues from shortening, reducing morning stiffness and pain. They are especially helpful for people with chronic plantar fasciitis or Achilles tendonitis. Night splints come in different designs, including soft boot styles and hard brace types. Wearing a splint may feel uncomfortable at first, but most people adjust within a few nights. It is important to choose a splint that fits properly and allows some movement without losing the stretch. Consistent use over several weeks can lead to significant improvement in symptoms. Adding night splints to a routine that includes stretching, icing, and supportive footwear creates a powerful strategy against morning foot pain. 8. Warm up your feet with a heating pad or warm bath. Warming up the feet before getting out of bed can help loosen stiff muscles and tendons. A heating pad, warm towel, or short warm bath increases blood flow, relaxes tissues, and prepares the feet for weight-bearing activity. Heat therapy is especially helpful for conditions involving tight muscles or chronic stiffness, such as plantar fasciitis, arthritis, and tight calf muscles. Applying gentle heat for 15 to 20 minutes can make morning movement easier and less painful. Always use low to moderate heat to avoid burns, and never fall asleep with a heating pad turned on. Combining heat therapy with gentle stretching increases flexibility and reduces the risk of sudden pain when standing. A daily habit of warming the feet can gradually improve mobility, comfort, and overall foot health, making mornings much smoother and more pleasant. 9. Maintain a healthy weight to reduce foot pressure. Maintaining a healthy weight is crucial for reducing foot pain, especially in the morning. Every extra pound adds additional pressure on the feet, stressing the arches, heels, and joints. Over time, this excess strain can lead to conditions like plantar fasciitis, heel spurs, arthritis, and tendonitis. Even a small amount of weight loss can significantly decrease the load on the feet, relieving inflammation and reducing pain. Healthy weight management involves a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Regular low-impact exercise, such as swimming, cycling, or walking, helps burn calories without putting too much stress on the feet. Strengthening the muscles of the legs and core also improves posture and distributes weight more evenly across the body. Setting realistic goals and making gradual changes can lead to long-term success. Consulting a healthcare provider or nutritionist for personalized advice can be very helpful. By maintaining a healthy weight, you protect your feet, enhance your mobility, and support overall health and well-being. 10. Avoid walking barefoot on hard surfaces. Walking barefoot on hard surfaces, such as tile, wood, or concrete, places tremendous strain on the feet. Without proper cushioning or arch support, the plantar fascia, heel, and forefoot absorb all the impact forces. Over time, this can cause inflammation, microtears, and worsen conditions like plantar fasciitis, heel spurs, and arthritis. Morning foot pain can be intensified if the feet are unprotected, especially after hours of rest. Wearing supportive slippers, sandals with good arch support, or cushioned shoes inside the house can prevent unnecessary stress. Soft rugs and padded mats can also help protect the feet from hard flooring. Avoiding barefoot walking is particularly important for people with diabetes or circulation issues, as foot injuries may heal more slowly. Making it a habit to wear supportive footwear indoors and outdoors can drastically reduce foot pain, promote healing, and protect the feet from further damage. 11. Choose proper sleep positions to avoid foot strain. Choosing the right sleep position is important to prevent morning foot pain. Certain positions, such as sleeping on your stomach with your feet pointed down, can tighten the Achilles tendon and plantar fascia overnight. This shortening leads to stiffness, making the first steps in the morning very painful. Sleeping with heavy blankets pressing the feet downward can also contribute to strain. The best sleep position for foot health is lying on your back or side with the feet in a relaxed, neutral position. Using a lightweight blanket or placing a small pillow under the ankles can help keep the feet properly aligned. Some people benefit from using a night splint, which holds the foot in a flexed position to maintain gentle stretching during sleep. Making small adjustments to sleep posture can ease pressure on the feet, promote better blood flow, and reduce morning stiffness. Over time, protecting the feet during sleep can lead to significant improvement in pain levels and overall comfort. 12. Rest and limit high-impact activities if overuse is the cause. If overuse is contributing to morning foot pain, it is essential to rest and reduce high-impact activities. Exercises like running, jumping, or dancing place repetitive stress on the feet, leading to inflammation, micro-tears, and pain. Without proper recovery time, the damage worsens, making symptoms more severe. Taking breaks from high-impact activities allows the tissues to heal and rebuild strength. Low-impact exercises, such as swimming, cycling, or yoga, can help maintain fitness without putting excessive pressure on the feet. Cross-training with different types of workouts reduces the risk of overuse injuries. Listening to the body and recognizing signs of fatigue, swelling, or pain is crucial. Incorporating rest days into your weekly routine gives the feet a chance to recover. Balancing activity with adequate rest helps prevent chronic problems and ensures long-term foot health and pain-free mornings. 13. Strengthen foot and ankle muscles with targeted exercises. Strengthening the muscles of the feet and ankles plays a major role in reducing morning foot pain. Strong muscles support the arches, stabilize the joints, and absorb the impact forces that occur during walking or standing. Weak foot muscles can lead to problems such as plantar fasciitis, flat feet, and ankle instability, all of which cause pain and stiffness. Targeted exercises like toe curls, towel scrunches, heel raises, and resistance band stretches can build strength in small foot muscles. Balancing exercises, such as standing on one foot, also improve coordination and stability. Performing these exercises consistently for a few minutes daily can make a significant difference in foot function and pain levels. Strengthening the calf muscles and Achilles tendon is equally important, as they work closely with foot structures. Gradual progression is key to avoiding overuse injuries. Stronger feet and ankles provide better support, reduce the strain on inflamed tissues, and help ensure smoother, pain-free movements after waking up. 14. Stay hydrated to keep muscles and tendons flexible. Staying properly hydrated is essential for maintaining muscle and tendon flexibility, which in turn reduces morning foot pain. Water helps keep the tissues in the body supple and resilient, preventing stiffness and cramping. Dehydration can cause muscles to tighten and become less elastic, making them more prone to injury and pain. Drinking sufficient water throughout the day supports healthy circulation, nutrient delivery, and tissue repair. People who exercise regularly or live in hot climates may need to drink even more to compensate for fluid loss. Including water-rich foods like fruits and vegetables in the diet also helps boost hydration. Avoiding excessive consumption of dehydrating substances like caffeine and alcohol is important. Monitoring urine color, aiming for a light straw shade, can help ensure proper hydration. Keeping the body well hydrated is a simple yet powerful way to maintain foot health, enhance recovery, and prevent stiffness and pain first thing in the morning. 15. Consult a podiatrist for a proper diagnosis and treatment plan. Consulting a podiatrist is an important step when morning foot pain persists despite home remedies. A podiatrist is a specialist trained to diagnose and treat foot and ankle conditions. They can perform a thorough examination, identify the exact cause of the pain, and recommend appropriate treatments. Sometimes, what feels like a simple strain could actually be a more serious condition such as plantar fasciitis, heel spurs, arthritis, nerve entrapment, or even stress fractures. A podiatrist may suggest imaging tests like X-rays or ultrasounds to get a clearer view of the problem. Depending on the diagnosis, treatments may include physical therapy, custom orthotics, corticosteroid injections, or minor surgical procedures in severe cases. Early professional intervention often prevents small problems from becoming chronic issues. Personalized advice from a podiatrist ensures that treatment is targeted, effective, and safe. Working with a specialist provides peace of mind, speeds up recovery, and helps restore pain-free mobility in the mornings and throughout the day. Morning foot pain can be frustrating, uncomfortable, and disruptive to daily life. It often results from a combination of factors such as poor footwear, tight muscles, inflammation, or underlying health conditions. Thankfully, with the right approach, most cases of morning foot pain can be managed and even prevented. Simple habits like stretching before getting out of bed, wearing supportive shoes, and using orthotic inserts can make a big difference. Applying ice, warming the feet, and massaging them regularly help promote healing and reduce stiffness. Maintaining a healthy weight protects the feet from excess strain, while avoiding barefoot walking on hard surfaces prevents unnecessary stress. Sleep posture also plays a crucial role in foot health, and making small adjustments during rest can ease pressure and support recovery. Strengthening the foot and ankle muscles provides better stability, reduces injury risk, and supports long-term mobility. Staying hydrated keeps the tissues flexible, further reducing the chance of tightness and pain. When home remedies are not enough, consulting a podiatrist ensures an accurate diagnosis and a tailored treatment plan. Early intervention can prevent chronic problems and promote faster healing. Combining these strategies creates a strong foundation for foot health, relieving discomfort, improving movement, and restoring confidence. Consistency and patience are key, as healing takes time, but steady efforts yield lasting results. Morning foot pain does not have to be a permanent struggle, and by listening to your body, making smart choices, and seeking help when needed, you can enjoy better mornings and a more active, pain-free life. Prioritizing foot care is an investment in overall well-being, allowing you to move with ease, energy, and comfort each day. Small daily actions add up to big improvements, making a world of difference for your feet and your quality of life.